some awareness programs for mental health issues that affect all of us. So if there's any particular topics that you want us to think about or anything like that, you can just give us a shout. Today we've got Della and Raquel from Talking Therapy. So without further ado, I'm going to just pass you over to them.
Hi everyone, thank you for having us. Really excited to be here. So as Bina said, yeah, I am Della and I work in Croydon Talking Therapies as an assistant psychologist. So today myself and Raquel are just going to be doing a short workshop in regards to kind of the services that we provide at Croydon, as well as a bit of general information about some of the things that we treat there. So yeah, I'll let Raquel introduce herself as well.
Good morning, everyone, and happy Eid. I heard that some of you might have celebrated yesterday and some might be celebrating today. As Della says, I also work at Croydon IAPT as a psychological wellbeing practitioner, or PWP for short. It's a lot easier to say. And as Della said, the idea today is just to kind of help explain what we do in our service, but also just to normalize some of the difficulties that we might be experiencing in regards to mental health, explaining what does it mean to have a mental health difficulty, how do we describe those things, how do we feel those things, but then most importantly, what can be offered to you as treatment if you are finding yourself struggling with those difficulties. So yes, that is what the aim is for today.
And also sorry, I was just going to say,
yeah, go ahead, Della.
Sorry, just considering as well, just like COVID and the changes that everyone might be facing at the moment, and how that might also have an impact and effect on mental health and access to support and isolation, that kind of stuff. So yeah, just try and touch on all those factors. Sorry, Raquel, do you know?
No, I was just going to say, should you find that you have any questions that you would want to ask us, please either use the raising hand function that's on Zoom, or just leave a comment in the chat. And I think Lizzie and Bina will try to help us sift through those questions as we're going through. But there will be a chance at the very end. We're aiming for around 20 to 12 to have a Q&A. So if there are questions you want to ask, but maybe you don't feel comfortable typing it in, then also please know that you can wait until the end as well.
Okay, perfect. So we have a slideshow that I will just share for you now that we go through. Let me get it up. Give me 1 second. It's always the thing about working on. Okay. Can everyone see that? Yeah, perfect. Perfect. So yeah, just a bit of an introduction. Looking after your emotional well-being is kind of the broad topic that we're really looking at today. Perfect. So before we get started, it's really important for us to really capture the people that we are presenting the workshop to, and it's also part of our funding with NHS. In order for us to be able to deliver these kind of workshops for free, it's really important for us to get these registrations from everyone that we're kind of working with. So everything that you do with registrations is confidential, and we really appreciate it. We'll give some time now, so I'll go through it with you to really help explain it, because sometimes it can be a bit confusing. And then I will also pop my email address in the chat, so once they're completed you can just send them to me directly by email. So as I mentioned, these are just really important just for us to get a really good idea about the people that we're talking to and that help form our workshops in the future, as well as making sure that we can continue to kind of deliver these. So what I do, I think Bina or Lizzie has posted it in the chat, the form. So if you go to the chat, you should be able to see the forms we're going to fill out, and I'll bring them up on my screen as well, just to help kind of run through them. It shouldn't take too long, but yeah, we'll give you time just to fill them out now, just to really help guide you through it. So let me get them up on here. So can you see these registration forms? Can everyone see them? And did everyone have access to them on their computer or what they're working from? I can't see the chat, so anyone just let me know if there is anyone having any.
I'm looking at the chat as well, Della, so if anyone has any questions, I can let you know.
Thank you, Raquel. So yeah, really simple. There's just 2 forms that we would like you to fill out this morning for us, just before we start the workshop. As I said, it's all confidential. No, it's nothing. Information is going to be shared with anyone else. It's just for us to make sure we can continue delivering these workshops. So yeah, if you could just go through the registration form, the name, family name, date of birth, address, telephone, email. Your GP surgery is really important, especially if you're in Croydon. And then tick that the box that is here as well. I think if you highlight it, yeah, exactly, it lets you tick it or cross it. And then just for sign, you can just, type your name out. Obviously, I know people on computers can be quite difficult to get your signature on this, so don't worry about that. And just date it. And then when we're looking at the second form, it's just, again, you're thinking just about over the last 2 weeks, how often have you been followed by the following problems? So now you can kind of highlight if you want, or cross out the other ones, whichever works best for you, or put a circle around, or even just change the colour of the number if that's easiest for you, just to make it clear which one relates to you. Don't have to worry too much about the total. I can do that, it's fine, just to speed things up. And again, the same with the core 10, and then again with the GAD7. So maybe if we just give kind of 5-10 minutes for people to do that, and then I will put my in the chat, I will just add now my email address, and then people can just send them to me when they're done. Is that okay? Do anyone have any questions, anything else they would like me to explain or anything? Or does that kind of make sense?
Yeah, there was just a question in the chat saying that someone has already done CBT with Croydon Talking Therapies. So they're already on the system. So they were asking, do they still need to complete this form today?
Yes, it'd be really useful if you're still able to complete the form today, just because especially in regards to the MDS bit at the bottom, so the bit where we're looking at the PHQ-9, course 10 and GAD7, will be more of kind of capturing how you have been in the last couple of weeks. So if you could, that would be really useful. Obviously, we might have the information from the first bit already, but yeah, if it would be really useful if you could still fill that out for us.
Is there anyone that, because I know it's difficult to unmute on Zoom, so if you need help, you can add to the chat, but if you can put up the little virtual hand as well.
Yeah, I've just added my email address as well into the chat for you guys. So you should be able to copy and paste. I saw a hand go up from someone there. I'm not sure.
Go ahead, Prasad.
Yeah. This is for everybody who is currently joining this session, or are people who are actually suffering from this mental health issue?
We would love it if everyone who's joined the session could fill out the form, even if everything's not at all and they're all zeros, and you don't feel any of it applies to you. That's still really useful for us as a service to kind of capture that. So yeah, if everyone can fill it out, even if everything is zero, that's absolutely fine. At least we have that as well.
Thank you.
Okay. And Sushil, I see that you said that you can't see the form. I've just added it underneath where you've written that. Can you see it now?
No, I can't.
Okay, no problem.
So you want us to do it immediately right now?
That would be great if it's possible. Yes, we're going to give till about 10 to, and for people to do it. If it does take you a bit longer and want to do it after, that's fine. My email just will still be there, but it would be really useful if we can do it now and kind of get them in, because I know it's easier to kind of do it if you have support. If there are any kind of questions, I can answer that for you now.
Okay.
Yes, madam. Can you hear me?
Yeah,
Yes,
we can
I
hear you.
Right. I don't know how to download the form. Have you got a phone number or an address where I can come and pick up the form, or I can phone and get more information? I've taken down Dela's email, but I don't know how to download the form.
Yeah, I mean, what might be best, if you want, you could send me an email and I could send them to you directly. Would that be helpful?
That's brilliant. Thank you so much. Thank you.
So my email address is in the chat. If you just email me and I can send them to you directly.
All right. Thank you. Thank you.
All right. No worries. So I'll just leave another kind of 5 minutes for people to do that. Does that feel like enough time for everyone? Yeah. Okay. So any other questions? Let me know.
Della and Raquel, I just want to check. You can see that I've put the form in the chat, yeah?
Yeah, I can see. I've also just sent the form from my end in case it could be like a server issue or whatever. I don't know.
Okay.
Shil, apologies if I'm saying your name incorrectly. Can you see the form that I've now sent in the chat, or are you still having difficulties?
No, I can't see it.
You can't see it still?
No.
Would you mind doing what Della had asked the previous participant to do, which is just to email her so that she can send it to you directly?
Okay.
Yeah, thank you.
I'll do that.
Sorry about that, sometimes technical issues, but yeah, if anyone has any difficulties getting the forms, downloading them, just drop me an email and I can send you a Word copy directly, and hopefully that should be a bit easier to kind of open it up. Just give kind of 3 more minutes, guys, and then we will continue on, and feel free to continue completing them and sending them over as soon as you finish. That's no problem.
And I guess one thing to say about the questionnaires you're completing, I know that sometimes some individuals kind of worry that the options that the questions ask you may not be 100% accurate to how you're feeling. So it's just about giving a generalized idea. So don't worry about if the options that are there aren't perfectly describing how you're feeling at the moment. It's just on average, how have you been feeling the couple of weeks?
I can just see a couple of emails coming through now, so I'm just going to respond to them quickly. Okay, guys, so just 1 more minute and then we will kind of go ahead with the workshop. Thank you for being really patient and doing this for us. It is really, really helpful for us as a service. So yeah, thank you again for taking the time to fill those out. The 2 people that emailed me, I have just responded, so you should get those questions soon. Hopefully you can open them up through that. And yeah, just respond back to that email address as soon as you've done them. Okay, perfect, guys. So what I'll do is I will share my screen again back to the presentation, and we will kind of continue. Everyone see that? Is that okay?
Yeah.
Perfect. Let me start from current side. Okay, perfect. So before we kind of start talking in regard to common mental health problems and how we at Croydon talk therapy, or IACT as we also know, kind of work with those, I thought I'd just give you a bit of a brief overview about Croydon talking therapies. So we work we're an NHS service working within SLaM, as Lizzie said, so that's South London and Maudsley Hospital, and we provide kind of psychological therapies, or talking therapies as sometimes they're known as, for people over the age of 18. So within that, we work with a lot of common mental health problems, such as anxiety, depression, and others that we are going to mention as well. But as well as that, we do a lot of signposting to similar other services within Croydon. So lots of the times when we get people who come to us for triages and the assessments, the initial assessments, if they're not suitable for our service, or we feel like there might be a service that's best suitable, that they may be more suitable for, we have lots of links with services, especially within Croydon, which we can signpost people to and make them aware of those. So that is another really positive thing about our service, is actually it's a great hub to come just if you need any kind of support, and we're normally able to signpost you to somebody who would be able to help in that specific area, who might be specifically focused in that area or have more specialty in a certain area. So yeah, we're providing a service within ours and also help linking up with other services. So to be eligible for our service, you need to live in Croydon and be registered with a Croydon GP, and those are our contact numbers and our email address. But what is important to note is that every borough within London has a similar kind of service. So if you're tuning into us now and you're not living in Croydon or have a Croydon GP, you will be able to find a service, for example, in Lewisham or Lambeth or any kind of borough that you may be in, which provides a similar kind of thing. And they may be run slightly differently, but generally every borough will have a talking therapy which you can self-refer to. Let me go next, that's a question. So first of all, I thought we'd just open up to the group really, and ask you a quick question about what do you think all of these people have in common? Has anyone got any ideas? Feel free to just shout out if you do, or comment in the chat if that's easier. Do you recognise any of these people at all? Do any of them stand out to you? Oh, I can see someone's speaking, but they're muted. Feel free to unmute yourself if you want to jump in.
Anxiety, stress, and feeling sad.
Yeah, great. Yeah, and I think so all of these people here are celebrities. Some of them you might recognise, some people you might not. But I guess the thing that they all have in common is that all within some point of their life have suffered with a mental health issue. Some of them have been more open than others, and some of them, have been at the forefront, kind of fighting and making awareness of these disorders. And some of them you may be more surprised at. I feel like last time we did this, people were quite surprised at Oprah. They weren't, I'm top right here, they weren't quite, didn't know about that. And I know Stephen Fry's done a lot of work talking about depression. So yeah, it's just to kind of show that actually these mental health issues don't discriminate, that even those people kind of in the limelight and the celebrities who, some people might have it all, actually as well still have these mental health issues. And I think that's really important. It's something that we'll touch on later in the workshop as well, that actually it didn't really matter, where you are, what time of period you are in your life, or what you might do for work, or if you're a celebrity, as you can see here or not, that actually mental health can have an effect on anyone at any time of their life. And also, again, that if it affects you at one point, it might kind of affect you later in life without ever having any issues before. I see someone just raised their hand. Did they want to ask a question?
Yeah, Gemma, just wanted to say that there's doesn't seem to be a representation from any Asian community in that particular picture, and that may give a false impression that Asian community don't suffer from mental health or need services, or it's. I mean, what it does do is show that clearly is not as well represented as other communities, which is one of the issues we know we need to deal with, but more of a pointer than anything else, really.
Yeah, I think that's an excellent point. And I think as you followed up as well with something that I was going to mention, that I think, as you said, it's not to say that people in the Asian communities aren't affected by it at all. And in fact, we know that's not the case. But actually, as you mentioned, that actually it's not as widely represented, and actually that, you know, for reasons within the culture and within, you know, that society, that actually maybe it's people aren't aware of the support and aware of it within that. And yeah, as you said, it's not as represented here. So yeah, thank you for that. That's really worked good out for us. Thank you. Someone else raise their hand. I didn't catch your name, but was somebody else?
For sure. I'll unmute you, for sure. Yeah.
Yeah. Hi. Yeah, I do agree with that point. That when it comes to the Asian community, we are very sort of not outspoken about our issues, and I have been myself long time back in depression, and it took me a while to actually recognize that state of mind of mine. And over the years, like I have tried to sort of get people more aware about it. I am a lifetime coach who you know tries to speak to people. So I do find it's a big issue with the Asian community.
Thank you. If I can just comment on what you've said, Sushil, I think it's such, both you and I think it was Imam made really valid points that Della's already touched on in regards to the fact that we know that when it comes to mental health and speaking about mental health and BAME populations, especially within the Asian community, it's very under the carpet, it's very hush-hush, right? And it's really, it's quite powerful even how in our workshop today, it's about kind of understanding not just the disparities, but difficulties we have in naming it, but also what you're all sharing is actually, it feels hurtful when that is not acknowledged.
Yeah.
It feels hurtful when my mental health, my emotional well-being is not acknowledged because it is something that is real and it is something that I experience. That is what you're all saying in response to this. So actually, I think that's wonderful because already you're saying, listen, in our Asian community, this is a problem. It needs to be addressed and we all need support. So in some ways, I kind of think it speaks quite nicely to the fact that all of you who are here, you're all ready to kind of defend the fact that having a mental health difficulty, whatever that may look like, does not take away from your humanity, doesn't take away from your need to be heard, a need to feel safe, but also a need to be validated and acknowledged. And that is definitely what we're hoping to do on our next slide. So Della, do you mind moving on to the next one for me? So why is it now that speaking about mental health is so important to the Asian community in specific? So thinking about everything we've just said prior, you know, in the last slide, I would like us to watch this clip that Della's going to pull up for us, and then afterwards we can share our reflections. Yeah. And do make any comments in the chat whilst you listen to the video or watch the video, should I say? Yeah.
Can everyone see that? Yeah. Let me go back to the beginning.
Experts are warning mental health services are failing some minority groups in the UK. They believe South Asian communities are most affected by barriers to finding support, including social stigma. This guy's Aisha Zahid has this report, and one of the names has been changed to protect the person's identity.
I was living two lives, one in front of everyone at work and family, and the other behind closed doors where I live. And it just couldn't go on any longer.
Hakeem's mental health struggles stem from abuse and childhood trauma. Facing stigma from friends and family, he lost faith in the system that was meant to support him. We've changed his name to protect his identity.
That first counsellor that I spoke to, that was the one that caused what was a 9-year delay in me actually going back and getting the help that I know I needed.
His fears revolved around his culture being misunderstood.
I didn't want to be stereotyped. I didn't want to be labelled more than I was already labelling myself. what I was looking for is someone that's actually going to understand the root of what I'm talking about, where I'm coming from, and then give me something to think about off the back of that. So yes, I didn't trust the process. I didn't trust the system, and I didn't think that they were going to be able to help me.
NHS data shows less than 3,000 per 100,000 Asian people are in touch with mental health services. For their white counterparts, this stands at more than 4,000. Uptake is lowest in the Indian community, with just over 2,000 per 100,000 seeking support. Suraj reached out for help after her son took his own life. But after facing barriers in treatment, she dropped out.
It would have been very helpful, someone who can understand my background as well at the same time, coming from the Asian community. I just think it was more of a book that he was more following, and I really felt it wasn't helping me at all. I didn't feel like it's me who's walked into this room. It's me who's gone through so much mentally being disturbed.
Experts say more cultural awareness is needed.
Within the South Asian community, there's huge stigma around mental health. We're finding that many South Asian people who attempt to access psychological services or any sort of mental health type treatment, it doesn't quite match or fit their conceptual needs and cultural needs.
Hakeem has managed to find support, but there are significant concerns for the many others unable to access help. Aisha Zahid, Sky News.
Thank you for that, Della. Okay, so maybe this story is not uncommon, right? For a lot of you here, maybe this might be something that you've all experienced or know somebody who's experienced. But aside from the barriers to the uptake of treatment, I mean, what do you think creates barriers to Asian individuals wanting to access therapy, even if some of the points might seem obvious to us here?
And I guess these don't have to be things that you have yourself experienced, but can anyone think of any barriers that they themselves have when trying to access at all from any kind of service of mental health?
Can I just make some input?
Yes, of course, yeah.
The faith in the system or the trust. Have we actually tried to look into that before we actually try and find a solution for it? Are we trying to create a process or a system that would build trust and faith? That's the fundamental question, number one. And the second one is, the other points that were made in the clip regarding the cultural awareness, under somebody understanding the root to the problem. I don't have a recent experience, but I do know a family that I went to visit in the States that lost their son who committed suicide. And in talking to them about, what effect they had, what that had on the parents themselves. I mean, the parents were both doctors, if you like. So that's the issue that I had where, the irony was, how can somebody in a doctor type of family would be the last person I expected would commit suicide. And one of the things that I found, there was still a feeling of little bit of reluctance for the parents to talk about it. They felt, quite rightly, the stigma and the impact on the community and all that in terms of their personal status as well. So there are a lot of barriers to break here. And it's a question of how we do break those barriers. Because unless you develop the trust and the faith in a system, this will be an ongoing problem.
That's a really great point. No, thank you for that. And I guess when you say trust and faith in the system, I mean, what does that look like? What is trust and faith in the system? And this is not just to you, but this is to anyone else who's here.
Yeah, it's the ability to have people that can talk to people with the right amount of knowledge and understanding of where either of the parties are coming in. I mean, if you are trying to save somebody, obviously we need to save that person, and we need to have an ability to be able to approach that person where there is faith and trust developed in an individual rather than a system. If he takes that on board, he would probably trust him to go through the system and the process that he needs to go through. But it's the trust and the relationship with the person that in front of the people to talk to.
Okay, yeah. So there's something about making sure that the relationship between practitioner and client is securely made, and then that hopefully can then allow for a greater trust within the actual system in which that service is being offered. I guess one thing to say to everyone here is that in Croydon IAPT, we actually, when we first give you that initial assessment that we call a triage, we will always ask you at the very end your preferences, and there's 2 preferences we will ask, especially depending on how you will identify. So we'll ask if you prefer for a male or female therapist, and especially if you are BAME, or let's say if you're even part of the LGBTQ community, we'll also ask, do you have a preference for your clinician to be of that community as well? So do you want them to be Asian? Do you need them to be Black? Do you need them to also be identifying as LGBTQ? Because as you said, understanding the cultural awareness of an individual that we're trying to, save or support is extremely paramount to how well treatment will work for that person. So please never be afraid if you ever come to our service to make that be known that it is something that you'd like to request. Yeah, there are 2 more hands up. So we'll take 2 questions and then we'll move on, if that's okay. Ian, I hope I'm saying your name correctly. I think your hand up was up first. Yeah, do you want to share?
Just put it down. Yeah, so I have a lived experience very similar to the one in the video. It's not just England that this applies to, because I had that experience abroad. And if I can break it down further, I think what's missing is, it's not that it's missing, how much are Asian communities, so I'm not South Asian, being East Asian, I'm just questioning how much of those Asian communities are taught on a cultural and parental level. So you're parenting not to speak up. I think in the West, we tend to speak up. You're taught that. So I have both experiences. And not only that, I also think, breaking it down further, how many people are actually having in a mental health crisis that they're not actually aware that they're in it. So it's recognizing that before you're seeking the service. Once you're aware, then the next barrier is seeking that service. So I just wanted to bring forward those 2 issues that I think can partly be at the roots of why the Asian community is less represented. So.
No, that's a really, it's a really powerful point, because it's showing in a systemic level that, if parents don't understand or have allowed there to be a conversation about it, and let's say their children now bring that to them, but actually mum and dad are also going through something too. And we know within Asian communities, extended family live within the home, right? They all form the family. So if grandma's also going through something, uncle might be going through something, but we're not taught to speak about those things. This is now what we sometimes see as being generational trauma. As children will now learn these behaviors.
Following a lot about that, actually. So I'm really into generational trauma, and I think there's not enough awareness as well about the generational trauma and what kind of trauma's there. And then the other thing that I just really quickly wanted to mention was the thing about the practitioner. So I also think that it's very important, to match up on a cultural level, because I also think that, certainly from my experience, because I was in a different country, I had a double barrier. So not just from my Asian Eastern culture, but also from an English level, because I was in the continent at the time. So my first barrier was actually, nobody is actually going to understand where I'm coming from. So I can also imagine that being a very similar situation here. So, and lived experience, having a practitioner with lived experience, whether it's on a cultural level or on a mental health level, I think it's also really, really important in the match.
Okay.
For trust building as well.
Yeah, for trust building. Thank you. And Emma?
Yeah, thanks. There's several things. One, I think already people have covered about the family being caring but isolating as well. So in certain instances where families are trying to protect, and it is from a view of protecting the person who's suffering, that it almost becomes isolating, and they preventing that individual from reaching out and getting help that they need, because the whole family unit needs help. So I think there's a serious of awareness raising. But that brings me on to another point about just even in the video that you were showing, I kind of expected it, that it would be somebody who'd got to a point of either killing themselves or something very extreme, or being sectioned, or something or another. When the fear of consequence is something that prevents communities from engaging. If all you're ever seeing is the one Asian person has been sectioned, or the one Asian person has killed himself, or one Asian person has been murdered, that's the expectation, because people don't see it as serious enough or unmanageable within the family unit to get it to the point until it's unmanageable for them. So that's the other thing about enabling communities, especially, I mean, the Asian communities are very, if they are enabled well enough, then there is much they can do within the own community to be able to support their own, you know, low-level mental health, or even beyond that. So the third point I wanted to make is a lack of investment. That's the biggest barrier. There has not been enough money invested into Asian mental health, because it's all categorized as BAME.
Yes, Emma, yes.
We know there's a huge investment in the Black community in mental health, because it's more talked about, it's more recognized, there's more services. I think we'd all struggled to think of more than one or two services that are tailor-made. And it's not about language, it's about the language of the culture.
Yes.
And that's different.
Emma,
So
sorry to cut you. I just love that you've said that, because you've actually then moved me on to my next question that I wanted to ask you guys on this slide. And just to say, before I even ask that question, you're all sharing such wonderful insights and reflections that I'm making note of, because it's something that we want to kind of give back to our service. Of course, as a service, as you've said, we are operating within a system. So we're kind of limited in terms of how much change can come, but we're hoping that through workshops like this, we can take your inputs, take your anecdotal reflections, and hopefully ensure that your needs can be met when you do come to the service. Now, in terms of the language you said, right, and how we describe it, in preparation for our workshop today, Della and I were kind of looking at, you know, articles and resources that speak to Asian mental health, just so we could come a bit more well-equipped for you guys. But then we also thought, actually, is it not better to just ask you, how is it that within your own communities, do you actually describe having a mental health difficulty or even an emotional difficulty? Because I think we came across a paper that had described depression as a sickness of the heart. And I imagine if you come to our triage assessment and we are not used to that kind of terminology, we wouldn't know what sickness of the heart meant. But in some communities, I think it was Afghani, they described, they described that depression was like a sickness of the heart, you know? So I'm just interested, what kind of words or phrases are most common within your community when you're describing having any kind of mental health or emotional difficulty? That would be useful for us to know. Feel free actually to drop that one in the chat, because maybe it'll take too long to speak and then we can move on. How does that sound? Yeah?
Very good. Can I just make a comment about a couple of points Emma made as well? I think I personally see that as, when we talk about the victim is at somebody's house, isn't he? He's living somewhere, isn't he? Everybody that we're trying to identify with mental health issues is living or accommodated somewhere. And the people that are close to him is the family members. And in the Asian community, family members, and it ranges from two different angles. One is, I would say, well off and probably in a very competitive type of atmosphere where they're trying to make sure that the children are educated as per their aspirations or as per the community or the group of community they belong to. And believe me, there is some competition. I want my son to be better than somebody else's son. And there are aspirations to make them like doctors and whatever it is. That's what I would was referring to in the previous example I quoted as well. And that was the major issue. They were forcing their child to go into a field, and the child wanted more of another career and not steps. So that was a very much a pressure situation. And the second side is, yes, there is an investment needed, absolutely right, in terms of relative deprived communities where they have absolutely no knowledge of how to tackle, let alone, first of all, observe that there is something going on in the family with one of the members in the family. Because they don't have any knowledge of, mental health in the first place. The investment that is really needed is educating the families, break down those barriers of stigma, make people aware about the mental health and how to detect it and how to identify the issues and where to help. That's all signposting. But then it's making people aware that these are the issues that we have identified in the Asian communities. And what we are trying to do is to educate it so that you become a little bit more aware about what effect it could have on putting too much pressure on the child or a family member that might want to follow a separate aspiration. Parent education is vital in this situation.
Okay, thank you. No, definitely. I think that is again another important point to make, because change can't really come just from one individual. It's more impactful if it's systemic. Within our service, we don't do family therapy, but if you were ever to come to the service for that initial assessment that we call a triage, and it seems that, let's say, family dynamics were the main thing that were kind of keeping the depression going or the anxiety going or whatever kind of trauma it is that you're coming to us with, then we would look to signpost you to more appropriate services. Any other questions, please just drop them in the chat, because I'm mindful of time. Della, do you mind moving on to the next slide for me? Okay, so just very quickly, I wanted us to just have a discussion about, or not really a discussion, but just to kind of differentiate what we mean between a mental health difficulty and a mental health diagnosis. As a few of you have mentioned, trust is a really big thing, for not just for Asian communities, but for everyone. But we know that, especially coming from an Asian background, you might feel very wary about disclosing that you have a mental health difficulty, even to your GP, as a fear of what that might do if you then go into employment, could it be used against you, etc. So typically, symptoms of mental health might be defined as, let's say, feeling tired, overly tired, which we'll come to describe a bit later on in some more detail, senses of hopelessness, worrying. You might find that you might be kind of what we call deactivated. It's not a term that I like, because I think it sounds very inhumane, but it just simply means you've kind of lost interest in doing certain activities to the point where your usual tasks and activities no longer bring you joy. They no longer bring you any level of like aspiration or fulfillment, and instead you find yourself feeling very flat in mood, right? So those are symptoms of mental health. Now, mental health diagnosis tends to only occur when a doctor who has a license to diagnose will use certain tools to look at the different symptoms that we just highlighted and then confirm the diagnosis. Then that is something that will stay on your chart with your GP. In our service at Croydon, we use similar tools, but we have no doctors here, right? So there's no one in our service who has a license to diagnose you as having anxiety, as having depression, or even post-traumatic stress disorder. We can't diagnose, but we do use the tools, i.e. some of the questionnaires that you just filled out at the beginning, to look at what symptoms are you mainly reporting, what are the severity of those symptoms, and then we can think very practically about the tools that we can use to help you alleviate some of those symptoms. Yeah. So whenever you come to us, just to reiterate, you are never being diagnosed with a mental health diagnosis. Yeah. Next slide for me, please, Bella. And as we've already touched on, and I think Emma had said this, we know that within within the UK, the term BAME has been one that's been bounced around a lot to kind of act as an umbrella term to describe Black, Asian, and other ethnic minority groups. And that can feel somewhat insensitive to those particular groups who fit within the umbrella. But they have found that as a result of COVID, there have been a lot of disparities between, or the disparities that already exist, between BAME populations, so that's Asian and Black and other ethnic minorities, have greater strengthened as a result of the impact of COVID. And we know that as Asian individuals, same way as a Black person, we will also feel things such as discrimination and racism, which will now superimpose the effect of COVID, having lost jobs, lost people who we care about. Someone said as well, the lack of empathy, lack of self-esteem, senses of competition, all of these things, right, that now add into the mix in addition to COVID. So we are aware that in a systemic level, the current climate of COVID has also created further disparities and inequalities to those who are not white. Yeah, so which is even greater reason for why accessing services like us can actually help you in making that space for yourself and understanding, why am I feeling the way I'm feeling? How long has this feeling been going on for? And now what can I do to help myself? Della, do you want to move on for me?
Yes, so now we're just going to kind of look over a little bit about some of the kind of main symptoms of the main issues that we kind of look at Croydon. As Raquel was saying before, like within our service, we don't do any diagnosing, and we looking at symptoms that may be occurring for people and trying to help them with proactive tools, mainly through CBT, that we'll look at later, of how we can really help with those. So first of all, depression is one of one of the main ones that we kind of look at Croydon. Again, with depression and feeling low, this is quite something that lots of people feel within their lives. Like it's quite normal for everyone at some point in their life to kind of have down days, have periods of their life where weeks where time where they're feeling very low, and as some of the things that Cal mentioned before, feeling like they don't want to do things and not motivated to do things. But the difference between kind of having those low and down days and kind of depression is that kind of persistently feeling sad for weeks. So rather than it just being something that comes and goes in passing, when we start to see the more issues, when it's something that is more persistent, when for weeks or months you're feeling these kind of feelings and feeling low and unmotivated. And as mentioned before, you can see the link. We won't watch it now just because of time, but we can send the slides so that you can have a look at the link in your own time. Is people describe this kind of depression as a black dog, like that black dog, a cloud over them, and that's how sometimes it's described, that kind of feeling of the weight of that kind of depression. And I guess some of the in depression, as in lots of these kind of things that we'll be looking at, there are both physical and kind of psychological symptoms that can come about with it. And I think what's really important to note, especially within Asian communities, is that actually, as you mentioned before, knowledge and like kind of like not understanding it and kind of the stigma around it, actually a lot of times a lot of these things that we're going to look at can present quite physically. So lots of Asian communities report that actually a lot more of the physical symptoms, such as feeling constantly tired and sleeping badly, and lack of appetite and sex drive, and that aches and pains can actually be presenting much more frequently, rather than the kind of more psychological symptoms, which might be feeling really unhappy and hopelessness and lots of interest and fear. And maybe that's because within thinking about culturally how families interpret these kind of mental health issues, how it actually might be presented more physically. So as we listed there, some other kind of depression symptoms that have been reported. So as I said, tired, aches and pains, no motivation, digestion issues as well can come up quite a lot as a physical kind of symptom of depression, and difficulty concentrating. So that's depression. And now if we just quickly look at anxiety as well. So anxiety, again, it's important to know that actually lots of people can experience anxiety day to day. And we've all had those kind of feelings of unease or worry or fear, maybe you're doing something new or doing something you're nervous about. Those kind of feelings in your stomach and that kind of anxiety is really normal. And again, the difference when you're kind of having this day-to-day anxiety, and the difference between when it can kind of start to become more worrying is when these you can't control these worries. So actually the worries that you might be having, might be taking over your day, and actually you're worrying about something all day, every day, and unable to control them. And that's when sometimes people might come to us and we can help with tools to help them kind of manage those worries. And again, there are many symptoms of this condition. Again, we have both psychological and physical symptoms. So when we think about psychologically, we're thinking about like restlessness and, you know, again, worrying lots and not being able to sleep because of worrying and waking up in the night because of worrying about different things. And when we're thinking physically, we're kind of thinking of like you know, sweating and heart palpitations. And often some people can experience anxiety like a heart attack. When we're thinking back to before, when we're saying actually in Asian communities, a lot of people experience all of these things much more physically. Lots of people going to, you know, doctor with heart palpitations, feeling like, you know, they're having a heart attack. And actually that might be a physical symptom of anxiety presenting itself. And, you know, so those kind of things. And anxiety is a kind of the main, it's like the core of lots of different anxiety issues. So we just listed some of them here that, you know, come to our service. General anxiety, so that kind of like general worrying about different things excessively. So lots of different things you're worrying about excessively. Then you've got the specific, more specific kind of anxiety, where it might be specific phobia. So, you know, people have like spiders, heights, blood, driving, those kind of things, and specific worrying around that. And then social phobia, so people experiencing phobias of being in social situations and being around people, new people they don't know, or talking in front of people they don't know. And then the excessive worrying before and after and during about how they might be perceived, or you know, what people might be saying about them. And then health anxiety, which is, you know, when a specific worry is about your health without kind of any reason to. So it's not saying, you know, you actually have a condition and you're worrying about that, but actually, you know, worrying that you might have something that isn't explained or anything like that, and researching it and that kind of stuff. And then lastly on there as well, obsessive compulsive disorder, so OCD. So it's kind of intrusive thoughts and obsessive thoughts that can carry out compulsions people might know of, like washing hands or, you know, light switches and those kind of things. So the anxiety is kind of a core within lots of different things that we see within IAPT and within mental health services. And then when we look within anxiety, is that kind of fight, flight and freeze. So what I like to do, and I'll open up to you guys, you can have a think about it, or you can kind of shout out as well if you'd like, is imagine you're in the sea and you're swimming around and you're playing and you see a shark in front of you. How do you think you would respond to that? How do you think you would respond in that moment? What are you doing? So does anyone want to shout out? Got a question, or anyone think, what do they think they would do if they saw a shark in the sea? What kind of things they would do? Oh, Prasad, I can see you speaking, but
yeah, absolute terror.
Yeah, exactly, absolute terror. And then I think, and then after that, you know, it's hard to know, isn't it, really? Because actually, the whole thing of this fight, flight, and freeze is that in while body responds to danger, in the flight, fight, and freeze response. So you might say, oh no, I'm absolute danger, and I'll swim away quickly. But actually, in that moment, it might be that the absolute terror means you freeze. And actually, although you're thinking, I need to get away, I need to do something because there's a shark here, your body is not moving, you're frozen. And this is what we call the flight, fight, and freeze response. And what is really important to note within this, when we're thinking about anxiety, is that lots of people can have anxiety and have these kind of responsive to things that people might not perceive as danger, but actually for that individual, they perceive that, and their body has perceived that as danger. So for example, if we look at a phobia of spiders, you might not think that spiders are dangerous, but for somebody, even the tiny spider, if they perceive that as danger, their body can go into the flight, fight, and freeze response. And this is an automatic bodily response that actually we don't have much control over. And what happens is, in that moment, when your body has perceived something as being dangerous, it actually diverts all of the blood away from your brain, so that actually goes to your body to for you to respond. So actually you're not thinking about it, maybe rationally to some people, about how you're reacting, but your body is doing what it feels it needs to do to get you away from danger. And that's what we kind of see within anxiety, you know, people having these kind of psychological symptoms, the sweating and heart palpitations and worrying, all that kind of stuff, is their body just reacting to what they perceive as dangerous. So I hope that makes sense to everyone. I hope that kind of the thing about the shark can really explain and really demonstrate that how, even if you think you might do one thing, when you're in that situation and your body perceives something as dangerous, actually there isn't always, you know, a logical thing for you to control how you're responding. Even if you go into situations think, I'm going to do this, once your body perceives that kind of danger, it's kind of doing its own thing. It's going down its own path of what it feels would be the best and quickest way to get you out of that perceived danger. And then we've got stress. So again, stress is a word that lots of people use to describe how they have different demands on their life. And actually, much like the fight, flight and freeze, it's the body's reaction and response to feeling threatened and to being under pressure. And in lots of situations, this can be really helpful. It can really help us, meet deadlines and, meet different demands in our busy lives. But actually, when that stress can become too much, it can make us feel really anxious and can really, affect lots of different parts of areas of our life, such as self-esteem, and can lead to burnout. And when we take into consideration lots of those other contextual factors that we mentioned before, of people in different communities that could also be added into it, just in the day-to-day world, how we can see how that really starts to build up. And that's when we kind of look at this idea of the bucket. So thinking about, everything we've mentioned before, all of those different things that might be going on for people. And then you have, taken into people the context of the life they live, the world they live in. So taking into consideration all those cultural and systemic pressures that Raquel mentioned before, and how they also might be adding into that bucket. So you've got a tap at the bottom of protective factors. So those are things, that are really positive and are helping keep that bucket level. So different coping strategies, support systems, friends, family, different structures you might be in. So, your Asian community, that might be a really good protective factor of, being able to lean on people and have that support of people who understand you, and all those different things. And then you have those risk factors of those life stressors. So, even things like systemic racism or, things at work and those kind of little things that add on to those. And then major life events. And as we mentioned before, and as we'll look at in the next slide, how COVID and that also impact within BAME communities with even more of an impact. So when we're thinking about all of, depression, anxiety and all those symptoms and stress, how it can kind of build up and how that bucket can get fuller. And without that kind of outlet, how we can see sometimes at different times in people's lives, it can become, really full. And that's when we were saying before that, and all of these mental health problems that we're kind of looking at don't discriminate, and they can come at any point in somebody's life, even if they've never had any issues with it before. There might be certain things, for example, now at COVID, that might be added to the bucket, and then all the other pressures added to the bucket that at any point, even if you're later in life or early life, it can affect you. And it said here, even eventually small things that you feel like you've dealt with before in your lifetime can then be a trigger to kind of the problems that we've been discussing. Does that kind of make sense to people? Does that kind of diagram explain how that might be? And as we mentioned before, then when we're thinking in regards to COVID and mental health, how that's really just adding into this bucket even more so. So, just thinking about the fear of COVID and the uncertainty of not knowing what's happening and what's going on. Lots of people have financial stresses and feelings of isolation, the worries about long COVID and how that might affect them and affect their family. And then obviously we've got lots of losses that we're dealing with, loved ones, jobs, businesses, routine, hobbies, even like the loss of hobbies that might seem quite small in the context of that bucket of stresses that might be going on. It's really adding to it. And then when we're thinking about that slide before that Raquel was talking about actually BAME and COVID, and how even for those communities it could be even more adding into the bucket. So how that systemically, that's those additions that some other communities might not have to even think about. So again, it's all adding into that kind of bucket of stress that could be leading to smaller things triggering, feeling low or feeling really anxious. It's all adding in. I can't see the chat, so I've been talking a lot, so I'll give a space to say if there are any questions that have popped up or anyone wanted to make any comments. So it's not just me chatting away at you. Are there any, let me have a look. Is there anything that anyone wanted to know at the moment, or anything that stood out for anyone? I can see Kumar raised his hand.
Hello, can you hear me?
Yes, I can hear you, Kumar, yes.
Right. Long years ago, I attended a few meetings organized by Depression Alliance and Depressives Anonymous or whatever. Now, do you all have meetings like that where people sit in a sort of circle and talk about the medications they take, how they feel, and that kind of thing, where you might feel more at home?
Yeah, so in our service, did you want to answer, Della?
Yeah, you go for it, Brad.
Yeah, so in our service, we do run workshops occasionally, and this will be tailored to specific difficulties that are quite common. So we might do a workshop for individuals who have long-term health conditions. I might be struggling because the long-term health condition might now mean that someone is struggling with anxiety or depression. As a result of COVID, a lot of these things are happening online. So be in a Zoom setting, not face-to-face. But the idea is that it's a workshop to kind of teach you how to best manage and monitor your symptoms of your long-term condition, as well as, you know, talking about medication, as you just mentioned, but also how your mood is affected. We also run workshops for depression as well. So if where individuals are really, really struggling to get themselves activated and motivated again, this can be a nice way to kind of just, as you say, be in a space where you're with other people, can kind of normalize that experience and it doesn't feel too isolated. I'm not aware of any other workshops that we have coming up well, you know, in the future. I know we also do some sleep workshops as well, because sleep is one of those things that is affected, as Della has said, when it comes to stress, anxiety, depression, anything like that. So yeah, those tend to be the workshops that we run, but I don't have any workshops that we have coming up to hand at the moment.
I think there is also a chronic pain workshop. So I believe at the moment they're running one on chronic pain. So, you know, thinking about if taking on all these factors and how actually also having a long-term condition, as Kyle was saying, and that kind of pain might be adding into, you know, just your ability to handle those stresses that might be in the way. So yeah, I don't know if that's what you meant by long-term condition, but yeah, I think the pain one.
Yeah,
well.
yeah, mm-hmm. Yeah. Awesome.
Okay, perfect. If there weren't any more questions, just aware of time. But yeah, feel free to pop in the chat if there are. Cool.
So CBT, right? So this is us now thinking about what do we do with the information that you've given us when you come to us at that initial assessment called a triage, and we're, you know, liaising with our senior colleagues to think, okay, you know, Kumar's come to us or Prasad's come to us with this difficulty. What can we offer him, right? To kind of support them with that difficulty. Now, in our service, we mainly offer something called cognitive behavioral therapy, which stands for CBT, and it's a very, very practical based treatment, meaning unlike counseling, where counseling is a space where you normally would speak about things that have happened to you in the past and how that's affecting you currently, and you kind of bounce back and forth between past and current, right? And you're normally directed to be really reflective on different avenues of your life where the difficulty you're experiencing currently may have shown up, right, in other scenarios. With CBT, that's not really the case. We're more so focused about how are you managing in the here and now. And typically, it's looking at your thoughts. So what types of thoughts are you having? How are you responding to those thoughts? And the emotions you have as a result of those thoughts and behavior. When we offer you treatment, we are going to be mainly looking at your behaviors, because the evidence for CBT shows that working on your behaviors first is most likely to get you into recovery than working on thoughts and emotions. And the reason being, and I know it might sound a bit weird to imagine this, but because thoughts and emotions tend to be, they're very fleeting, right? You guys can know in a whole day, how many thoughts and feelings do we have from when we wake up to by the time we go to bed, right? Very, very fleeting. And those aren't things that we can grab, right? They're really intangible. So with that, they also tend to be more long-standing, meaning that you might have had these thoughts and feelings for a really long time, which makes it very difficult to work with. However, if we change your behavior, so let's say if you are experiencing stress, like Della had outlined, and as a result of stress, you might be overworking, right? So the behavioral response to stress is you overworking. We then look at helping you to think, okay, how can you break down your day-to-day tasks in a more manageable way so that you can kind of reduce the level of perfectionism that you're applying to your day, reduce the impact you now have when you perceive yourself to having met or not met your standards for the day, and also to kind of tailor down the different activities you choose to do. So you learn how to break down activities, manage your expectations, and then essentially better manage that stress. So when you first come to us, CBT, if we are going to be treating you, is what we'll be offering you in the service. Thank you, Della. So just to kind of explain some more about what this will look like. So as I said, it can help by supporting you to make changes in your cycle to improve your mood and your anxiety. And as with the example given with the stress, ideally what it's trying to help you do is to create a balanced routine of pleasurable, routine and necessary activities. And this is specific for those who are experiencing symptoms of depression. If you're experiencing symptoms of anxiety, the behavioral technique used for that is called worry management. And here we will teach you ways to kind of talk back to your anxious thoughts, be a bit more assertive to your anxiety so that you're not so passive to the worries when they come to you, and you're allowing yourself to give yourself space so that that fright, freeze, and what's the other one? Fright, freeze, and I always forget the third one. What is it, Della? Fright, freeze, and what? There we go, that one, right? When that process is activated, you're allowing yourself to have time, because I've supported clients where their anxiety is so heightened that every anxious thought they have, that response is activated, and then the individual doesn't know that they still have time. They forget that they're in the moment and that thing that they're worried about has not even happened yet. So when we do worry management for your anxiety, that's what we'll be teaching you. As mentioned earlier as well, we can also help with sleep, to help you have a better sleep hygiene, as we call it, so that you can make sure that your sleep schedule is a bit more conducive for you to having a better quality sleep, but also in general, just to help you make more positive life changes, to help you improve your energy levels, to boost your mood, and to also help you get into a habit of challenging your negative thoughts and any unhelpful thinking styles you may have. So very similar to the anxiety, for those of us who might sometimes experience low mood or symptoms of depression, it is really common for us to have moments where our own thoughts start attacking us, because we now believe that we can't do something well, we now believe that we're a failure, we now believe that our life is doomed. All these things, right, that can happen when we are triggered by certain situations, be it work, email, a meeting with your supervisor, family issues, family health, your own health, all these things, right, can then trigger those unhelpful thoughts. So learning to challenge that on a day-to-day basis is what you'll be taught. And CBT can be quite difficult because it does require you to be accountable to your own treatment, and it does require you to make the time in your week, daily, and I stress daily, to practice these routines so that you're forming a new habit in how you think and respond to the things that trigger you into feeling low or anxious. Thank you, Della. So some of the techniques. So when we are having that initial, fright, flight, and freeze response, and an individual is feeling very anxious, or even if you're feeling very low, as I mentioned, sometimes what tends to happen is that with anxiety, we know that it's one of those difficulties that causes us to hypothesize the worst case scenarios to the point where in our current moment, we actually forget that we're safe. So in Della's slide a couple slides back, she mentioned that, imagine you see a shark, right? How would you respond to that shark? But sometimes that shark for us, when we have anxiety, it's not that the shark is right there, it's that we're imagining what will happen when we see a shark. So actually we become anxious in a moment where the shark is not even there, but we think the shark is coming soon. We don't know when that shark will be there. And so versus us just getting on with our day and realizing that we're safe within the day, we now think, oh my goodness, the shark will come out any time. I've got to make sure I'm prepared, but I don't know how to prepare myself because I can't actually guarantee when this shark is actually going to appear. The shark can be synonymous to a work email, to relationship issues, to being stuck in traffic, the different things we hear in our service, right? Different things that can trigger people to feel anxious. So one of the things we might teach you, if we see that you're really struggling to kind of keep yourself focused in the present moment, are different like mindfulness techniques. So this one here is called 5, 4, 3, 2, 1. And as it simply states, the idea is to ask you to in your mind, when you notice that your heartbeat's increasing, you're getting that shortness of breath, just give yourself time to kind of take a deep breath and say to yourself, what are the 5 things I can see? What are the 4 things I can feel? What are the 3 things I can hear? What are the 2 things I can smell? And what is 1 thing I can taste? The idea of this is that by focusing your attention on the things that are happening around you in the current moment, allows you to then bring your awareness back into the moment right now versus into the worries that your anxiety is trying to prepare you for in the future. Yeah. And another exercise we might do with people is something called guided imagery. So here, what we would do is we'd ask you to kind of, close your eyes, imagine a place that you personally would identify as being a safe space, as being a space that brings you tranquility, a place that brings you peace, a place that really brings you comfort. And we'll ask you to think about, what do you notice around this space? Very similar to the 5, 4, 3, 2, 1. What can you see in this space? What can you feel in this space? And sometimes when you're allowing yourself to feel really comfortable in this space, we might even ask you to say positive words to yourself. So I know within the Asian community, many of you might be familiar with, things such as like affirmations, right? We know that there's a lot of power in the words that we use. So I might ask you to say certain words to yourself about, bringing peace to yourself, bringing kindness back to yourself, bringing love back to yourself. And in return, may even ask you to do that to somebody else who you care about as well, just so that this can then help you return that same level of peace that you're wanting to hone into yourself onto others. So I think earlier we mentioned about compassion. Sometimes individuals struggle with compassion. We can always give it to other people, but we struggle to give back to ourselves. So this guided imagery is one way in which we can help you to learn to be more compassionate to yourself, and knowing that it is okay to be compassionate to yourself. Yep. And then some resources. So if you guys want to take a screenshot of this slide, just so that you can have a look online for any resources that can help you if you or somebody that you know is going through a mental health difficulty. We'll leave it up here just for you to screenshot it. There's lots and lots and lots of self-help materials online. I will say be careful what you choose, because some things, are better than others. So please do have a screenshot of this so that you can keep it for your personal use. And then once you guys have screenshot that, we can then move on to questions and answers, I believe. Is that right, Della? Or is there something else? Oh, so yeah, go ahead, yeah.
I'm just going to briefly mention kind of, I guess, what we offer within IAPT, kind of things that we can offer. So obviously we mentioned before that within our kind of initial assessment, which is a triage, if your specific issue that you're facing might be more specialized or might have a particular focus, we have lots of signposting to different organisation services within Croydon. But something that we offer within our service. So we have an online program called Silver Cloud, and this is based in many of the same CBT principles that Raquel was explaining. And how that works is you're paired up with a clinician such as ourselves who will be supporting you through that. And it's more self-directed, where you have a module to kind of complete each week, which will give you tools and different techniques like the ones that Raquel just explained. And you'd be supported by a clinician who will be writing your reviews and checking in with you sometimes on the phone as well, to really help you through that. So that's really a great way for people who need the flexibility of, might be working with children and have, you can dip in and out at any point in that week, and how you would for you to kind of do it on your own back while being supported. Then we have a kind of groups that we were talking about before, and Raquel kind of mentioned as well, different 6-week groups. These at the moment are more limited because we're doing them online, and we'll just kind of get back into that process of delivering them virtually. But yeah, just to think about stress and worry, behavior activation, long-term conditions that we mentioned before, that chronic pain one we were talking about. And then we have also the 10-week groups on low self-esteem. Again, I don't know if one's actually running at the moment on this because of online, but we are trying to get these groups back up and going and get people engaged virtually. And then we also have guided self-help, which again is off the principles of CBT, but rather than kind of doing it self-directed on the online program Silver Cloud, you are paired with a clinician who you kind of touch base with weekly, who will be supporting you through that. So it's much of the same of psychoeducation around and education around specific difficulties you might be facing, and then also looking at different tools really, so that's specifically around what you might be thinking about. So as Raquel was saying, if it's anxiety and you have excessive worries, then it's really looking at that worry management and that worry tree and the worry time. I'm really explaining that to you and helping getting you to use those tools. Or if it's feeling low mood, it's behavior activation and activity scheduling, and how can we get you a bit more motivated and doing things again. So that is over the phone or video at the moment. And then we do have some limited availability for counselling. Now this is very limited within our service, but we do have lots of other services that we can signpost to as well that can provide counselling services. So as Raquel mentioned before, there's much more the space to look at past and present and how that might be influencing moods and your feelings and how, you know, things that you might face might be impacting on your life now, and more of actual space for discussion rather than the kind of proactive tools that CBT kind of provides. Then we also have a service called Work Well Croydon, which works very closely with us in SLaM, who are provide support around employment and mental health and stress. So they work very closely with us. We can refer you directly from our services, and they can help provide support, like I said, in regard to stress and mental health that might be kind of impacted by work. And then lastly, we've got the CBT, it's cognitive behavioral therapy, and that is our kind, which is up to 12 kind of 1 hour sessions. So it's very similar to the kind of guided self-help, but it's much longer time frame. It's 12, so it's double the sessions, and also longer time that you spent with the clinician each week. So that might be looking at things more like PTSD and OCD and those kind of things that require a bit longer time to really kind of break down and really help support. So those are kind of some of the stuff that we do within our service. And just a little bit as well on how to kind of access our service. So you can self-refer. So that's our website there, and that's probably the easiest way to kind of do it. Just fill out the form on our website, self-refer yourself, and would book you in for an initial assessment. And then you can also ring in, our numbers there. So it's a little bit covered up there, but you can ring in and kind of refer over the phone, and they'll book you in. And you can also be referred by your GP or healthcare professional. So they can also refer you as well and book an appointment. As I said, you can self-refer, which is, you know, the easiest way possibly. So yeah, that is the slides for today, and give you yeah, a bit of time to ask any questions that you might have, and yeah, or any comments you wanted to make. Does anyone any questions or anything at this point?
I think I speak for everyone. I just say thank you. Just before we go into questions, yeah, I just want to say thank you, because you really gave us so much information. I'll pass over to Prasad because he has put up his hand, but thank you very much for your presentation.
No worries, thank you for having us.
I know that the SLaM also works with the charities as a partners, right? Because long time back, many years ago, I couldn't get the support that I needed from the SLaM because it was catering to all kinds of people, right? And especially too busy with highly vulnerable groups, I would say. Okay. So I approached a charity called Mind, Croydon Mind, So they were very receptive, and they were very, face-to-face counseling and all those things. So when you're talking about getting support to the people, you never talked about your partners, right? They are also refer you or guide other people to you, right? That's one of the way you support them as well, isn't it?
Yeah, and I think one of the slides that Cal mentioned was actually about Mind, and we do, as I mentioned before, we work very closely with lots of different organisations, and Mind is one of them. Thank you for mentioning them, Prasad, because we signpost a lot of people to Mind, specifically, as you mentioned, for counselling, as they have a great counselling service there, as well as I think they do an anger management group as well, and kind of support for carers. So yeah, we work very closely with different services, especially within Croydon. And if there's anything, I mean, normally anyone that comes to us for a kind of initial assessment for that triage, if there's something that we can't do within our service, we would most definitely have like kind of signposting for them for a service that will be able to help. So no one ever really turned away with like, no, there's nothing we can do to help. There's always another service that we would kind of suggest for them to access that support, and Mind being a very popular one that we use a lot.
Thank you.
Okay. Are there any other questions anyone had? I see the other question in the chat. Yeah, and that Raquel answered, but yeah, we work within Croydon, but as I mentioned before, every borough will have kind of their own IAP service, who will do very similar, so signposting and also CBT within the service. So yeah, if you were relaying information to somebody outside of Croydon or live outside of Croydon yourself, there should be an IAP service for that borough as well. Any other questions at all, or we've talked enough?
I was just going to say that there was a question in the chat that probably doesn't want to go out publicly, I'm not sure, but just it was just from Philip, and
I've already responded to him privately,
cool.
Lizzie. Yeah.
Good. I just wanted to check that. Thank you.
Okay,
I think that's it then.
All right, guys. Well, thank you very much for having us, and thank you for your input as well. I think I speak for Raquel and I when I said just having that feedback from people experiencing themselves and having stuff that we can take back to our service as well is really useful. And actually, we're kind of learning and much from you. I think the other way around. It's really great for us to have stuff we can take back and kind of feedback to people.
Definitely. And on the back of what Della has said, I think one of the things we would like you to also remember is that a lot of what we had said today had involved things around the community and involving family. In our service, as I mentioned, we don't do that kind of support. However, please do not let that deter you from still advocating for yourself. If you are needing support because you are identifying that you're going through some kind of emotional difficulty, regardless of how that might be seen in your family home or friends of friends, if you know that you're struggling, advocate for yourself, come to the service, and let us give you an assessment to see how we can help you. Yeah. Simple as. We know that mental health affects everybody. You're not unusual, you're not strange, you're not defected. You are still part of your community. Even if you have a mental health difficulty, it changes nothing about you. So please remember that. And if you need to come to the service, then speak to your GP, go online, or call us on our admin line, and we'll give you some support where we can. Yeah.
And also, just lastly to mention, really annoyingly, if you can
get the questionnaires.
The questionnaires. Just lastly, if you can get those questionnaires over to me on my email address, that'd be great, and we really appreciate it. And yeah, thank you for your time.
Thank you.
Thank you so much on behalf of ARCC to both of you. What an amazing session. And hopefully you can come back and do some more sessions for us on particular topics. But as to everybody on the call, please do send those questionnaires back to Della as soon as you can, preferably just after this call, so that Della can do whatever she needs to do with those forms. And thank you everybody for attending. Hope to see you all soon. Enjoy the day and the sunshine and the hot weather. Take care, everybody.
Thank you. Bye-bye.
Bye-bye.
Bye.